is resulting in hospitalization increases across all age groups, including children aged 0 to 4. The emergence of the Omicron variant again emphasizes the importance of vaccinations and boosters, which decrease the risk of infection, severe disease, and death caused by COVID-19. Just last week, we made important progress towards increasing booster coverage through four key actions. First, we expanded eligibility of booster doses to those 12 to 15 years old. Second, CDC strengthens its booster recommendation for adolescents, now recommending that adolescents aged 12 to 17 years old should receive a booster shot 5 months after their initial Pfizer-BioNTech vaccine series. Third, we recommended that moderately or severely immunocompromised 5 to 11-year-olds receive an additional primary dose of vaccine 28 days after their second shot. And fourth, we shortened the recommended time between a primary mRNA series and a booster dose from 6 months to 5 months. Each action increases access to vaccines and booster doses at a time when protection is critical. As we continue to monitor this rapidly evolving virus, we are working quickly to adapt with it. Over the holidays, CDC updated our quarantine and isolation guidance, first for healthcare workers and then for the general public. I know this update has resulted in numerous questions, so I would like to take a moment to walk through it now. For people who tested positive for COVID-19, CDC recommends isolation for 5 days. If you are asymptomatic or if your symptoms are resolving, for example, you're without a fever for 24 hours, you no longer need to isolate. However, you should continue to wear a well-fitting mask at all times when around others, including at home and in public for an additional 5 days. We recommend that you avoid activities where you are unable to wear a mask and that you avoid travel for the full 10 days. In addition, CDC changed the recommended duration of quarantine. Quarantine is what you do after you're exposed. People who are not up to date on recommended COVID-19 vaccines should quarantine for 5 days if they come in contact with someone with COVID-19. People who do not develop symptoms by day 5 should get tested. If you test positive, you should begin isolation. People who test negative may end quarantine and should continue to wear a well-fitting mask when around others for an additional 5 days. These recommendations are consistent with over 100 studies collected over the past 2 years, indicating that people are most infectious during their first few days of infection and significantly less infectious 6 to 10 days after infection. A core part of CDC's mission is to translate science into recommendations for best practices and real-world circumstances. Over the holidays, we saw the growing surge of Omicron and took swift, science-based action to address the very real possibility of staffing shortages in hospitals and in other essential areas of the workforce, including schools, pharmacies, public safety, public labs, grocery stores, and other sites, where shortages could have and have proven to have dire public health consequences. This is the right guidance for what we currently know about transmission and the real-world circumstances we currently face. As we will learn more, we will continue to update accordingly. Omicron is likely not to be the last curveball this virus throws at us, but we have the tools to prevent further spread of this virus. This means for everyone 5 and older, please get vaccinated. For those 12 and older, get your booster shot. And please continue to adhere to the multi-layered prevention measures, including masking and, yes, washing your hands. Thank you, and I look forward to your questions.
Thank you. Dr. Fauci.
Madam Chair, Ranking Member Burr, members of the committee, thank you for giving me the opportunity to discuss with you the role of the National Institute of Allergy and Infectious Diseases in the conduct and support of research addressing our nation's response to COVID-19. In our most recent hearing before this committee on November the 4th, I discussed the importance of booster shots to enhance immunity against the Delta variant that wanes over time. Indeed, booster shots have dramatically reconstituted the waning immunity and has increased protection over and above the original level afforded by the primary vaccine regimen. Today, we are faced with a different challenge, a new variant called Omicron that has rapidly spread throughout the world, including a massive, unprecedented surge in the United States. This variant possesses a large number of mutations that are associated with an increased efficiency of transmission, immune evasion from certain monoclonal antibodies, convalescent plasma, and antibodies induced by our current vaccines. Thus far, data from our own laboratories at NIAID, as well as from laboratories throughout the world, have indicated that vaccine-induced antibodies lose a considerable amount of potency in neutralizing the Omicron variant. Although this is of obvious concern, the encouraging news is that a third shot boost of an mRNA vaccine significantly reconstitutes and enhances the ability of antibodies from boosted individuals to neutralize the Omicron variant, strongly suggesting that boosters will play a major role in protecting our population, at least from severe disease, in the context of the ongoing massive surge of the Omicron variant that we are currently experiencing, underscoring why it is so important for the unvaccinated to get vaccinated and for those who are already vaccinated to obtain the booster shot. Therapies in general are an important part of our armamentarium against COVID. In this regard, the NIH has been heavily involved in the development and/or clinical testing of several effective monoclonal antibodies against SARS-CoV-2. However, we have ascertained that certain of the authorized monoclonal antibodies are negatively impacted by the Omicron variant. Direct antiviral therapies also are an extremely important tool in the fight against COVID-19. Importantly, it appears that the mutations expressed by the Omicron variant do not interfere with the oral antiviral drugs Paxlovid and Molnupiravir that NIH-funded investigators played an early role in developing and that have recently received emergency use authorization from the FDA. Nor do they appear to interfere with the FDA fully approved drug remdesivir, shown by NIH-sponsored studies to be highly effective in preventing severe disease. Looking ahead in the context of the inevitable continual emergence of new variants, the importance of developing a pan-coronavirus vaccine, namely one that would be effective against all SARS-CoV-2 variants and ultimately against all coronaviruses, becomes even more apparent. My colleagues and I recently published a paper in the New England Journal of Medicine emphasizing the urgent need for such an effort. In this regard, we have made significant progress in that direction. We have identified antibodies that neutralize multiple different coronaviruses, and in addition, NIAID has issued new awards to fund pan-coronavirus vaccines at 4 academic institutions. These awards will fund multidisciplinary collaborative teams to conduct research focused on coronavirus virology and immunology, immunogen design, and innovative vaccine and adjuvant platforms, as well as technologies to discover, design, and develop pan-coronavirus vaccine candidates. Finally, I would like to close by looking forward to how we might best enhance our preparedness for what inevitably will be the emergence of future pandemics. The NIAID will play an important role in the multi-billion-dollar all-of-government plan for pandemic preparedness. Our mission is the rapid development and implementation of successful countermeasures against several prototype pathogen families of viruses that threaten the health and safety not only of our nation, but of the entire world. Thank you for your attention, and I would be happy to answer your questions following the presentations.
Thank you. Dr. Woodcock?
Good morning, Chair Murray, Ranking Member Burr, and members of the committee. Thank you for the opportunity to testify. FDA's thousands of employees remain steadfast in fighting this pandemic. Our work continued during the holiday season and led to critical advancements in combating the virus. The agency has been closely monitoring the potential impact of the Omicron variant on the currently available vaccines, diagnostics, and therapeutics. I'll provide a brief update and actions the agency has taken in these three areas since I last testified before this committee. First, regarding vaccines. The currently authorized and approved vaccines remain highly effective at preventing serious outcomes associated with a COVID-19 infection, including hospitalization and death. Additionally, data evaluated by the FDA suggests that an additional booster shot following the completion of primary vaccination provides further protection against these outcomes. Following these data, FDA updated the Pfizer, BioNTech, and Moderna vaccine EUAs to shorten the time between completion of a primary series and a booster dose to at least 5 months rather than 6 months. FDA also updated the Pfizer, BioNTech EUA, so it's now available for a primary series in children ages 5 and older, and for the use of a booster dose in all individuals 12 through 15 years of age after completion of primary vaccination, as you've already heard from Dr. Walensky, as the CDC followed up on this. The agency also authorized the Pfizer vaccine for a third primary series dose for certain immunocompromised children that are 5 through 11. These vaccines have met FDA's rigorous standards, and the bottom line is getting vaccinated or receiving a booster with one of the currently available vaccines is the best thing the public can do right now to protect themselves and those they care about. It is not too late to get vaccinated or get boosted. Second, diagnostic tests, which are another key line of defense in this pandemic. Increasing access to accurate, rapid, at-home tests continues to be a priority for FDA. Since I last testified, the agency's authorized 4 additional over-the-counter at-home tests, bringing the total number to 15. And the agency continues to prioritize the review of these type of tests. We also partnered with the NIH to establish ITAP, which streamlines validation and authorization of antigen tests with potential for large-scale manufacturing. We expect shorter review times for such EUA requests due to our partnership with ITAP. In fact, the first 2 tests that participated in this program were authorized in 2 days or less from the time FDA received the final data. So this is a very good model for government assistance of diagnostic manufacturers. In this new program, ITAP will prioritize new over-the-counter test submissions that could be manufactured at significant scale to accelerate the availability of high-quality, accurate, and reliable tests for the public as quickly as possible. Third, as new variants continue to emerge, it's crucial to expand the country's arsenals of COVID-19 therapeutics, especially for those unable to get vaccinated or who can't respond to vaccination. Since I last testified, 3 therapeutics have been authorized for use in the treatment of COVID-19 for emergency use. The first of these EUAs, EvuShield, was authorized for the prevention of COVID-19. The other 2 therapies, Paxlovid and Molnupiravir, as you heard from Dr. Fauci, are the first authorized treatments for COVID-19 in the form of a pill that can be taken orally, which is a major step in the fight against this global pandemic. These authorizations provide new tools to combat COVID-19 at a crucial time, and it should make antiviral therapy more accessible to people at high risk for progression. Now, while these are important tools, they're not substitute for vaccination in people for whom vaccination is recommended, and I continue to urge the public to get vaccinated if eligible. And fourth, we continue our mission of protecting the public from fraudulent medical products. Since March, we've refused admission of more than 23,000 lines of FDA-regulated products that were trying to get into the country illegally. And finally, I want to assure the public that FDA is committed to continue to use every tool in our toolbox to fight this pandemic with the best available diagnostics, life-saving therapeutics, and vaccines. Thank you, and I look forward to your questions.
Thank you. Assistant Secretary O'Connell.
Chair Murray, Ranking Member Burr, and distinguished members of the committee. It is an honor to testify before you today on efforts within ASPR to respond to the pandemic since the emergence of the Omicron variant. When Omicron first emerged, as we have done with each new variant, we immediately evaluated its impact on our current vaccines, therapeutics, and diagnostics, and adjusted our response accordingly. Data suggests that our current vaccine doses with a boost confer protection against Omicron. As a result, we have continued distributing the 3 authorized and approved vaccines. Over 600 million doses of vaccine have been developed and delivered since the start of the pandemic. We have ample supply of both primary and booster doses, contributing to more than 200 million Americans now being fully vaccinated. However, we have had to make adjustments to our therapeutics supply in light of Omicron. 2 of our workhorse monoclonal therapies, one from Lilly, the other from Regeneron, are not as effective against Omicron. As a result, we have increased our supply of GSK's monoclonal, which is effective. We continue to purchase all that we can from GSK, though this supply is still limited. We are on track to have 250,000 courses available this month. A 4th monoclonal by AstraZeneca is targeted for immunocompromised individuals at high risk and is taken prior to exposure to prevent infection. It has retained effectiveness against Omicron, and we will have made nearly 500,000 courses available through the end of this month. All 4 monoclonals are currently available for states and jurisdictions to order free of charge on a weekly basis to treat either Omicron or Delta infections. Also, we now have antivirals by Pfizer and Merck that are effective against Omicron and are being delivered to states free of charge every other week. We have procured 3.1 million courses of Merck that are now available. Last week, we doubled our commitment to order 20 million courses of Pfizer's product. We have 265,000 courses available through this month and anticipate delivering the first 10 million courses to states by midsummer. We remain in frequent communication with states and territorial health officials on the distribution of therapeutic products and continue to focus on ensuring these life-saving therapies are available to Americans across the country. The dramatic rise in cases due to Omicron has put a significant strain on our testing capacity. Despite significant effort and investment, there's more work to do, and we are working every day and night with manufacturers to increase the availability of tests. As soon as we saw the dramatic increase in cases in South Africa and Europe, we reached out to test manufacturers to understand their surge capacity and supply chain constraints. We are engaging daily with the lab test providers to mitigate any supply chain constraints with their sub-tier suppliers. We are also working with the commercial and public health labs to prioritize their needs. We continue to use the Defense Production Act's authorities when needed. To further increase test availability, we are procuring 500 million rapid tests to distribute to American households. As a requirement in this procurement, none of these tests can interfere with what is available in the current commercial market, so as not to diminish what consumers are able to access now. We are currently shipping 2.8 million tests to long-term care facilities per week, as we have throughout the pandemic. We continue to work to send 50 million rapid tests to federally qualified health centers and food banks, with 7 million having shipped so far. And we will keep working around the clock with manufacturers and our government partners to increase and sustain the number of tests available now and in the future. And finally, in addition to vaccines, therapeutics, and testing, ASPR continues to provide on-the-ground support to states and communities in need. Since July, 40 National Disaster Medical System teams, nearly 880 team members have deployed to 19 separate states and the Commonwealth of the Northern Mariana Islands to support a range of functions, including hospital augmentation and decompression, setting up medical overflow centers for patients, and mortuary support. We continue to send supplies as requested from the Strategic National Stockpile, including 300 ventilators to 6 jurisdictions since the emergence of Omicron. We are grateful for the support from this committee and Congress, and I look forward to answering your questions.
Thank you to all of our witnesses. We will now begin a round of 5-minute questions of our witnesses, and I again ask my colleagues to keep track of your clock and stay within those 5 minutes. As the Omicron variant of COVID-19 continues to spread at an alarming rate, people are looking for clear, straightforward guidance on how to protect themselves and those around them. It is really critical that we reduce the infection rates so we can relieve pressure on our healthcare workers, protect people with disabilities and older Americans, young kids, and anyone else who's been disproportionately impacted by COVID-19. However, I have heard from so many people who find the latest CDC isolation and quarantine guidance confusing and hard to interpret. So Dr. Walensky, can you please clearly explain CDC's latest guidance on what people need to do to protect themselves and others if they are exposed to or contract COVID-19? And let me start with vaccinated people. What is your guidance to them?
Thank you, Chair Murray, for the opportunity to clarify. Maybe if I could just rewind the clock to just before the holidays, where we were hearing from hospitals that their staff were going out and that they were in a real crunch in terms of beds. They had plenty of beds, but they didn't have staff to staff them. ICU beds were starting to close. So immediately we worked towards our updated healthcare worker guidance. But when we did so, we recognized that we were going to have challenges and that this Omicron surge that we were about to face was threatening many other places of our healthcare sector.
I appreciate the background, but I just want to know straightforward, if someone is exposed to or has COVID-19 and they're vaccinated, what do?
If they are exposed to COVID-19 and they are completely boosted, they do not need to stay home. But they should get a test at day 5. If they have COVID, our guidance does not distinguish between your vaccination status. And our science has demonstrated that you're maximally infectious 2 days before and 2 to 3 days after. So by 5 days after your symptoms, if you're feeling better, if your fever is better, if your cough and sore throat are better, then on day 6, you can go out, but you have to wear a mask. You have to wear a mask reliably, and you should not go to places you can't wear a mask. You probably shouldn't go and visit grandma. You shouldn't get on an airplane.
For vaccinated, what about unvaccinated?
Same for unvaccinated for isolation. So isolation being those who have had disease, who have disease.
Okay. Well, let me just say nearly 2 years ago, when this committee first started having congressional hearings on COVID-19, the very first thing I asked was, where are the tests? And we've made progress since then, and we're now producing 300 million rapid at-home tests each month, along with ramping up our lab-based testing. But I am disappointed, as I said, by the testing challenges that we're facing. Tests are hard to find. They're costly. People are unable to find the at-home tests in pharmacies, online. They're waiting in long lines, and often after that, waiting days for results. So it's, ineffective at the end of the day. So Ms. O'Connell, I want to ask you, what are you doing to address the frustrations and challenges we are hearing about COVID testing?
Chair Murray, thank you so much for this very important question. Testing remains a critical priority for this administration. When we saw the unprecedented cases of Omicron sweep into South Africa and Europe, we immediately reached out to our manufacturers to understand any supply constraints they had and to evaluate their surge capacity. We have also met daily with them to make sure that they have what they need from their suppliers, and have used the Defense Production Act authorities 12 times throughout this pandemic in support of testing needs. Most recently, in the last few weeks, for 2 tests, we were able to unlock supplies and manufacturing capacity. We continue to invest in rapid over-the-counter tests, which are in high demand. And in the fall, we invested $3 billion to increase manufacturing line staffing and to commit to those manufacturing lines for 13 months. As a result, we went from 46 million tests, over-the-counter tests available in October, to the 300 million, Chair Murray, that you just mentioned that are available now. But that's not enough. We're continuing to bring tests to the American people. As a result, the president has announced, and we're in the process of procuring the 500 million tests, which every American household will be able to order and have shipped directly to their house. We have completed 4 contracts so far, have secured 50 million tests, and are in the process of securing the additional tests over the next several days. The U.S. Postal Service has agreed to do the distribution, and the U.S. Digital Services is going to help with the website. We anticipate the first test going out at the end of this month, with the remaining tests going out over the next 60 days.
Okay, and I'm out of time, but I do want to just say this. I am hearing from so many schools that are having trouble staying open. They want to stay open. Part of it is they have staff that are sick. That's understandable. But a big part of it is they don't have access to the safety measures like masks and testing supplies. What do I tell them about where they go to get that?
Chair Murray, thank you. Schools having enough testing supplies to stay open is a critical priority for us. We've invested $10 billion of the American Rescue Plan given to states to support and stand up testing programs. We've also invested $650 million in a program called Operation Expanded Testing, which set up regional hubs of labs that schools could contract with to run their testing programs. But that doesn't work if there aren't tests available. So ASPR is working directly with states to match additional manufacturing capacity with states that need it. Not only that, we are in the process within ASPR of looking at our contracts to see if we have any additional capacity, and will commit to sending that capacity to the school programs.
Senator Burr.
Thank you, Madam Chairman. Let me just cut to the chase. Dr. Fauci, you said CDC was going to update its guidance and include antigen testing, or suggested that it would. Dr. Walensky and CDC came out with the guidance that didn't include it. Was that part of the communications plan to start with and they diverted, or was that something you just chose to inject?
Thank you for that question, Senator Burr. In discussions about the real gray zone, which Dr. Walensky described, about after the 5 days where you have a considerable diminution in the likelihood of being transmitting, we had been in discussions about what the role of antigen testing would be. And as a matter of fact, when Dr. Walensky came out with the final guidelines, they include that if you have a test available, you may take a test. So at the end of the day, we were quite in concordance with our views.
Well, I think the chair and I share this. We found it very confusing. And I think the American people found it confusing. And I don't say it lightly when I say not too many people in America are listening to what comes out of Washington, whether it's Congress or out of the administration as it relates to COVID. So the president makes an announcement, Ms. McConnell, of 500 million at-home tests. Is this the first time that you've thought about purchasing at-home tests, or have you tried to before and it was rejected?
Thank you, Ranking Member Burr. This is the first time the administration has committed to purchasing tests to send to the American households.
So is that ASPR or is that DOD? Because of all the notifications of contracts signed, I've seen them from DOD. I haven't seen them from HHS.
Thank you for that question, Ranking Member Burr. We have a relationship with DOD for assisted acquisitions. So ASPR will request that DOD put out a solicitation or manage a contract on our behalf. They're able to do it extraordinarily quickly. And we've had an MOU in place with DOD for this work that will run through June 2023. We've used this relationship to purchase vaccines and therapeutics, and we're now using it for testing.
So the best I can find, you mentioned 50 million doses having been contracted. I can identify 27 million out of 2 companies, Media and Atlantic Trading. Neither one of them are manufacturers of tests. And I believe the third one, Revival, is not a manufacturer of tests. Media actually came to fame was importation of vodka. and tying cell phones to vodka. And like a lot of other companies, they got in the PPE business in 2020 with some nominal FEMA contracts. Why should we have any confidence in these contracts if in fact we're dealing with companies that don't manufacture anything? And can you assure me that the tests that are coming in are not coming from China?
Thank you, Ranking Member Burr. Absolutely. These tests, what we initially did to be able to access tests for the initial shipments that will go towards the end of January, we worked with warehouses to see where additional tests were stored and assessed that additional capacity and are bringing that capacity to bear for these initial tests that are going out, which is why you're seeing contracts with warehouses and not with test manufacturers.
So is what you're telling me they've got 50 million tests in warehouses in the United States and all we did was access that inventory?
That is my understanding.
Well, will you confirm your understanding? This is a very, very important piece when you've got companies that don't manufacture tests and all of a sudden we're giving them a $190 million contract for about 14 million home tests and their expertise is importation of vodka. I encourage you to look through the list of people that we're signing up with. Are you aware that some of the larger test manufacturers in 2021 shut down lines because of the lack of purchases for at-home tests?
One of the things we did in the fall with the $3 billion investment that we made was to turn lines on and to commit to those lines for 13 months so they wouldn't be turned off again.
Dr. Woodcock, let me just, last question, Chair. Of the 15 tests that you've currently approved for over-the-counter, how many detect Omicron?
We're still working on that, but we believe all of them detect Omicron. We simply feel they are somewhat less sensitive than they were to some of the previous variants.
Of the 50 million tests that the ASPR has contracted for, how many of those tests detect Omicron?
I don't know which tests there are. We can get back to you on that.
So you haven't consulted with what we're purchasing on the 500 million. They haven't consulted with FDA to figure out whether the tests they're buying actually detect Omicron.
I believe they have. I simply don't have that list.
Okay, I thank the chair.
Senator Kane.
Thank you. Thank you, Chair Murray, and to the witnesses. Dr. Fauci, can you provide us a general breakdown of what percentage of hospitalized individuals are vaccinated versus unvaccinated, and what percentage of COVID deaths are among vaccinated or unvaccinated individuals?
Thank you for that question, Senator Kane. One of the ways to answer that question would be to look at people who are in the hospital and take a look at if you are vaccinated versus unvaccinated. And if you look at vaccinated versus unvaccinated, there's about a 10 times greater chance, 18 times greater chance, 17 times, 20 times infection, hospitalization, death.
Thank you, Dr. Fauci. Ms. O'Connell, I want to ask you a question about vaccine severity of illnesses and hospital admissions. However, they've had more limited success in preventing forward transmission from vaccinated individuals after breakthrough cases, and the existing vaccines are not as durable as vaccines in other areas, so we need booster shots to continue to protect against the virus. Is the administration considering supporting the development of additional vaccines that might be able to address the gaps in the current vaccine's capabilities?
Senator Kane, thank you so much for that question. Yes, absolutely. I think we all see the need for next generation vaccines. We are also looking for next generation antivirals and therapeutics as well. We're in the process of working with Dr. Fauci's team to develop a unified NIH BARDA research agenda and budget to address these issues, to identify candidates that might already be in the pipeline, to help support the research into candidates that are just starting in the pipeline, so we can accelerate the availability of next generation vaccines and therapies.